So I say good morning to our World Wide Web as well as our local audience. For those of you who join us regularly, you know we're broadcasting from Down East Nursing Home, where we connect up with 970 in a Husky radio station. And then we're also going live over to YouTube. So for all of you who are catching us in all those different categories, we welcome you. And those of you who are local, if you like to catch us on the internet and watch the program live, but just as opposed to just hear it, you can go to my website, which is askdrferguson.com. In the middle of the subpage, you'll find it says Live Radio. Click on the Live Radio connection, and that will take you to a YouTube page, and that will be a Hangout page. On there, the top left-hand corner, you'll see a little house. Click on the house, and then click on Feed, and you'll catch the program live. It's about a 30-second delay, so you probably want to turn the radio off and not try to do both the radio and the YouTube. So, welcome, Bishop. How you doing?
I'm doing fine. Hope that you are.
I'm doing great. Hope you had a good week so far.
Thus far, yes. Thank the Lord. Thank the Lord.
Well, that's good. You know, technology is something, and I'm still hoping for some better reception from where I'm at. But you know, when you're in the country, internet service can be challenging.
Yes, indeed.
So I'm noticing today on my live broadcast that it's got that delay to it. You know, I move my head and then my head moves. So I can only imagine what the voice is going to sound like today. But hopefully the voice will be fine as long as you don't try to connect it up with the face. Like the Chinese movies, you know, where they don't connect.
Oh, yeah, that could be...
Yeah, the old karate movies.
Yeah.
Where they took it in one language and converted it to English, and it didn't really convert so well. Yeah, I've seen quite a few of those.
Amen, amen.
So, you know, people keep asking me about the Ebola virus issue, and I just want to, I guess, give some kind of reassurance to people here in the United States. Unless you're coming in contact with somebody that's been in one of the Western African countries, your chance of getting the Ebola virus is slim to none.
Yeah, yeah.
Now, the other factor is you also don't get the disease unless the person is showing symptoms of having the Ebola virus. So you can't just have it and not be asymptomatic. They have to actually have it and be symptomatic before you even have a chance of getting it. Now, the death toll is getting high. I keep hearing it going up every day. I think it's over 1,300 people now.
Yeah, it is very high, very high.
And, you know, I was listening this morning. They quarantined off a whole big, for us here in the United States, it would be like quarantining the whole Greenville. But they quarantined off a whole place that I was hearing today. It only had one road in and one road out, but supposedly the population was packed very densely into that area. So it is a major problem. It's a major problem, one, because we don't have a cure, two, because a lot of these patients are very rural and don't have access to the internet and telephone and TV like we do. And so some of the information doesn't get out to the to the far boonies, and one person in the village gets it now and they don't know what's going on. It could wipe the whole village out.
Right.
So so it's very dangerous disease. Some of the symptoms of the Ebola virus would be they call it a hemorrhagic fever disease. So it would include a fever, headache, joint pain, muscle aching, weakness, diarrhea, nausea, vomiting, stomach pain, decreased appetite. And you could have some abdominal bleeding. And these are things that are very similar to what you would get at any flu, except the bleeding part. So those are very similar symptoms that one would get, but it's transmitted through either a bloody fluid or either blood or some type of bodily fluid from the infected person, and it's through exposure. You transmit it through direct contact, through needle contamination, things like that, an infected syringe. So, this would be a major problem for those that are hooked on drugs.
Yeah, I was listening to you name some of those symptoms, and for some people, they may not even recognize because of all the different kinds of symptoms.
Right, and the other thing, it's not airborne, so you won't get it. It won't come via the air. You won't get it via water products. You won't get it via food. So that's a good thing.
Yeah.
Food, water, air is not how it's transmitted. is transmitted through direct contact with either bodily fluids or blood. So for those that are, in the nighttime persuasion job opportunities, and or those that are in IV drug abuse, it could really spread like hot fire. Mm-hmm. And one of the challenges when a person has, either working as a prostitute or something like that, or hooked on drugs, your thought process can become very foggy. You know that you're having symptoms, and you know that you got something bad, but you need your drugs, so you go on and do it anyway. I know a young man who was hooked on IV drugs, and he knew he had AIDS, and he shared a needle with somebody anyway because he wanted his drug so bad.
Oh my goodness.
And so those kind of things happen because your judgment gets foggy. When the reason when a person has a drug addiction, when they don't get their drugs, they're going to start having withdrawal symptoms, and the withdrawal symptoms in their mind could definitely sound like worse than these symptoms if you don't connect death to it. A person that's withdrawing from drugs, they could have seizures, they could have night sweats, muscle aching, cramping, nausea, vomiting, stomach pain, diarrhea. They could have any of those symptoms, and that's why many people won't stop their drugs, because once they become addicted, if they don't get their drugs, they'll have some of those symptoms, and those symptoms could last anywhere between 5 and 10 days. And so nobody wants to be sick, and most people aren't willing to be that sick, and so what do? They go get some more drugs so they can prevent the sickness from coming on. The same difference with alcohol. The alcohol gets what we call DTs, and that can have some similar type symptoms. And how do you prevent a person getting the DTs? You give more alcohol. Or unless you try to treat them, unless you treat them with medication that we have to utilize for that. So I say that to say that your thinking can be a little foggy sometimes when it comes down to not being in pain or discomfort, and sometimes people do things they shouldn't do.
Right.
And that's just the bottom line. It's the facts of life. I don't know anybody who wants to be sick. Anybody who wants to have pain and discomfort. And if you know that getting your drugs can get you out of the pain and discomfort, despite the fact that you might get something, sometimes they think the risk outweighs the benefit, or the benefit outweighs the risk, I should say. But anyway, just to briefly talk about that again, I have people ask me about it in the office, and I wanted to let you know that if you live in the United States and you're not in contact with somebody that's been in Western Africa, the chance would be slim to none. And I'm sure that our U.S. government is doing a great job of screening people that are coming from the African continent in general, probably, as opposed to just Western Africa. Screening them when they're coming back to the United States. I'm sure they're having to go through tests. They might even be getting quarantined. I don't know. But I'm sure we're taking proper precautions because this disease has been so deadly.
Yeah, I've heard some reports that they are taking every precaution as possible.
Yeah.
Those who are returning from the U.S., like those ones who have been and gotten sick when they came back, they are being screened. Right.
Now it's like a 2 to 3 to 21 day time process where if you got the virus, you'll come down with the disease. I guess there's some people that have a strong enough immune system that don't come down with anything, but I don't think we know enough about it to know who those people might be.
Right.
To try to evaluate them and see what's in their immune system that's preventing this from spreading. But God wonderfully made these bodies of ours, and we are capable of resisting a lot of stuff. So many diseases could come our way, but they don't, because our body has a protective system. It has an immune system. And that immune system is here to protect us and to fight off infection and colds and viruses. And when our body gets hit with a dose bigger than what our body can handle, that's when we get sick. But we get exposed to stuff all day long, but most times we don't get sick, and that's because of our immune system.
Thank God for the immune system.
Thank God for that. It's constantly working. It's constantly moving. It works. It's throughout your body. You have lymph node areas throughout your body, and so you have regional places in your body that help fight off infection as well. You have the armpits. You have the groin. You have in the back of your spine. You have your neck. You have all types of different places in your body that if your infection comes anywhere near that region, well, that region will put out the white blood cells first.
That's interesting.
Then you also have the spleen, which is like the major factory. So the spleen is the major factory, and then everybody else kind of gets its orders from the spleen. But throughout the body, you have the lymph system, and you have the lymph nodes that are in different areas. A lot of times, if you have a cold or infection, you feel your neck, you feel a little lump in your neck, a little knot. It feels like, well, that's a lymph node. They get inflamed, not inflamed, but they get enlarged because they're making more white blood cells to help you fight off that infection.
Okay.
And when they do get enlarged, they usually get swollen and tender. And why? Because it may start off the size of a little pea, but if it's got a big infection to fight off, it may get the size of a big marble.
Is that why sometimes maybe going to the doctor or the dentist, they will like take the fingers and just under your jaw to feel?
Absolutely. That's part of a good physical exam. Particularly if you're doing a head and neck exam, you need to feel the lymph nodes in the neck. You have a posterior chain, you have an anterior chain, you have a part that's right over your clavicle, you have a part underneath your chin. So you have about 4 common areas of lymph nodes there in your neck. And when evaluating a person for any type of head and neck problem, maybe they got a toothache, or maybe they have a sore throat, or maybe they have an earache, we're always going to try to check those lymph node areas to see if they have any enlarged lymph nodes. Now, an enlarged lymph node is normal sometimes for children. The lymph nodes kind of go back and forth. Sometimes we call it shoddy nodes in their neck. But when you become an adult, they're no longer normal. And so if you have a lymph node that's in your neck or anywhere on your body that stayed for more than a month, you need to definitely get that checked out by your healthcare provider, because that could mean something more serious.
Another reason why this program is so important to the listeners.
Absolutely. So that's just another tip. I didn't plan to talk about the lymph system today, but that's an important tip to understand. Don't palpate a node in your neck or a little mass or a little lump or however you want to describe it and not get it checked out. Same thing will go for any other place in your body. There's so many things in your body. It could feel abnormal to you, but can be no big deal, like a lipoma. A lipoma is a little fatty tumor underneath the skin. It grows very slowly. It's usually a little movable, and usually they don't cause any problems. Their biggest problem is usually cosmetic. So person doesn't like the way it looks. Maybe it's on their forehead, or maybe it's on their hand, or something like that. So they might get it operated on because of that. There are other things that are common that are benign, like a ganglion cyst. That comes out of a joint space. That's usually in your wrist area. Sometimes it can also be in your feet area. That often doesn't cause any problems, but again, that could be a cosmetic thing. So there are lots of lesions that can come up that have nothing to do with cancer. We talk about lesions. There's many different types of skin cancer. You have basal cell skin cancer, squamous cell skin cancer. You have melanoma. Anytime you get an abnormal area on your skin that doesn't look like it's going away, get it checked out. Don't just ignore it. A melanoma can be very, very small and spread and be life-threatening from a small little area on your skin. So if you have a mold on your skin, and many people have many, don't get too alarmed, but you want to watch all the modes and see if they change in color or shape. And that's when it becomes serious. Say you got, 500 modes all over your body. Well, it's hard to have a good surveillance on all of them, but if you have a husband, a spouse, friend, family member, and you have them look at your back and look at it regularly, maybe once a month or so, and make sure that they look really good at all the different areas, and if they see an area that they perceive is changing in color or shape, then that will be a reason to see your healthcare provider.
Okay.
So again, but most moles on your skin are going to be benign, meaning not cancerous. You have cancer, which we call malignant or neoplasm, and then you have benign. And I could say a tumor mass, and that tumor mass, that doesn't say cancer, that just says it's got a mass. Now, is that cancer benign or is that cancer malignant, meaning that mass, meaning cancer? So they could be multiple different things, but don't ignore lymph nodes. Stomach cancer, you can have stomach cancer, you can get a big lymph node right in the supraclavicular area. So if you touch your clavicle and go right in that little soft spot right above your clavicle, that's what we call the supraclavicular area. And if you were to have a node in that area, that could suggest you have have stomach cancer.
Oh.
That often could come from many times from a person that's been a heavy drinker.
Okay.
So that you know, there's so many signs and symptoms that we put together to try to come up with a diagnosis when you're in medicine. And yeah, the immune system is very, very important. When a person's immune system is down or decreased, they're prone to getting an infection. They're prone to coming down with everything. And this is why eating habits become so important. So important that you have a good, healthy eating habits. That you're not eating junk food and the sweets and the sodas, but you're eating the chicken, the fish, the turkey, the baked, broiled, steamed, or grilled, drinking a half a gallon of water a day, provided there's no problems with your heart or your kidneys, eating lots of fruits and vegetables. Raw is best, frozen's next, and canned would be worse. So it's important that you develop some healthy eating habits so that your immune system can be as strong as possible so that you're in position to fight off infection. You're fighting off infection constantly you don't even know about. Your body's taking care of those things. And it doesn't tell you about them until you don't have a strong enough immune system, and then you get a runny nose, you get a sore throat, you get a cough, you get a fever, chills, night sweats. Those are all signs that something got past your immune system and was able to affect your body. Now, your immune system still has the ability to fight, so your immune system, even though you have those symptoms, the immune system still is out there fighting and battling, and so it still might get that particular process in check without taking an antibiotic or an antiviral agent. But if you needed that, that was fine. Say you have a pneumonia. Pneumonia could be from a virus or a bacteria, and when you get or it could be from a couple other things. We'll stick to those two. So say you get the pneumonia, now you're sick, you're not feeling well, you got a fever, you feel lousy, you don't want to do anything. So now what happens? You go to the doctor, say it's a bacterial infection, we give you antibiotics. Well, the antibiotics help beat up the bacteria that's affecting your body negatively, and now your it's like bringing in extra troops. It's like you got your front line. It's like being in Ferguson County right now. You know, you got the police force that were there, but then they couldn't do the job, so they had to bring in the National Guards. So they brought in their backup. And that's the way your immune system is. If you're having an infection somewhere, your immune system tries to do the best it can. If it can't, then you start having signs and symptoms of being sick. And that's when you go to the doctor. We give you an antibiotic, antiviral agent. It helps kill off some of those bacteria that are harming you or virus that are harming you. And now your immune system can take back over. And actually, they're going to work in harmony. It's not going to be like one works, the other one works. They're going to be working at the same time. Does that make sense?
That is really interesting. I'm serious.
Yeah, so that's the way that fight takes place. And you know, anytime a person gets sick, most times they come to the office. They say, "Doc, I got an infection. I need an antibiotic." Well, infections don't have to be from a bacteria. They can also be from a virus. And if your infection is from a virus, then an antibiotic is not what you need. And so take it easy on your healthcare provider, your doc, and don't be mad with them when you go in and they don't give you an antibiotic, particularly if they perceive that's not what you have. You know, if you've got a good healthcare provider, they're going to resist giving you an antibiotic if they don't think that's what you have. Some docs will just give it to you anyway and send you on your way to not have a long conversation with you or to think they're sending you out happy. But it's important that we look at all the symptoms. A lot of times a person comes with a seasonal allergy type symptoms. Again, that's associated with the immune system again. And so they're having maybe some sneezing, maybe runny nose, maybe even some coughing. They usually don't feel too bad. Usually what's running from their nose is clear. If they cough, that might be clear. So all of those things suggest that that's an allergic reaction to something. So you're having maybe it's pollens, maybe it's grass, maybe it's the blankets you just pulled from the attic, maybe it's some cologne. You could be allergic to anything. And so when you're having those type of symptoms, that doesn't require an antibiotic. But I'll have patients come to the office and say, "Doc, I got a cold. I need an antibiotic." Well, what are your symptoms? And they'll describe the things I just said to you. And I'll say, "Well, no, you don't have doesn't sound like you got an infection, but it sounds like you have an allergy to something." So let's sit back for a moment and think about when you're worse. Are you worse when you go outside? Are you worse when you get to the work? Are you worse when you go to your cousin's house? When are your symptoms worse? Are you worse when you go to your bedroom at night? So you could be allergic to anything, the new carpet, the blanket, the sheets, the anything. It could be dust mites within the bed. Anything could be causing these allergy symptoms. So we have to try to do a trial and error, and we have to become a detective to try to see, okay, what's going on in your life that you might be allergic to. And then sometimes we can figure it out, sometimes we can't. Those times we can't, then we have our allergist who can help us. Yeah, you can see the allergists. Those are the doctors who specialize in figuring out what you're allergic to. And they can test you, they can put little marks on your skin, they can test you a lot of different ways. And then if they find that you're allergic to certain things, you can be desensitized. And that would be getting a shot once a week, once every other week, once a month. But the shots, it takes a long time to desensitize a person. You know, when I first moved to North Carolina, I knew I was going to be coming to the country, and I knew some of the things I was allergic to already. And so I began taking shots to become desensitized to some of the things that I knew I was already allergic to. And I took those shots probably for about a year, and I just got tired of it because my symptoms were still there. And it can take 5 years sometimes to become desensitized. And I started taking a product called Defendol. That's a homeopathic product that I use a lot in my office. I started taking it like October. By the time I got around to my worst allergies time of the year, which is like June, July, I was you know, and mixed in pollen and all outside and grass and all those things, and I wasn't having any symptoms. And so Defendol is a very effective product. It takes a while to work because your immune system changes every 2.5 to 3 months. Every 2.5 to 3 months, your cells, the white cells, red cells, they die off, and you get a new set. But they don't all die off at the same time. It's constantly happening so that you're constantly replenishing.
Oh.
Okay. And so, and that's why Defendol is effective, because when your body is going through these changes and bringing up a new set of cells, when you're taking Defendol, the new set of cells are coming up in a new environment. It's like you got new neighbors. And so over time, and I can't tell you how long a time, maybe 6 months to a year, if you're taking Defendol consistently, you'll probably get rid of your allergies. At least that's what the case has been for me, and I've had hundreds of patients on that with also having some great success. So I know I kind of threw that in. For those of you interested in Defendol, you can go by my website, which is askdrferguson.com. You can look under the homeopathic section, and you'll see Defendol. It's pretty much non-problems associated with it. The side effects are basically zero. You kind of dissolve it in your mouth, and you take it consistently, a couple tabs a day, and over a period of time you'll find a boosting of your immune system. If you have asthma, it will probably help some of your asthma symptoms, but don't think it's going to work like an antihistamine. It's not going to work instantly, so you can't take it now and say, oh, I still got symptoms this evening. That's antihistamine is going to fit that category.
Yeah, I remember you talking about Defendol in the earliest programs that we've had.
Yeah, it's a great product. I've been personally using it since 1998, and allergies are a thing of the past for me. And you know, it also helps boost the immune system, so it helps fight against cancers, infections of any type, antioxidants, the vitamins. We've had some shows recently talking about vitamin C and other vitamins. They're good antioxidants. They also help fight against infection, help boost the immune system. Again, we ended up talking about the immune system today, and anything you're going to do that's going to make you be healthier is usually going to help your immune system. So what does that mean? That means having an exercise regimen, something 3 to 5 times a week where you're going to get your heart rate up and keep it up for 20 minutes. That means drinking a lot of water. The average person needs about a half a gallon a day to sit on the couch and watch TV. It means watching your food, watching your diet, trying to eat lots of healthy foods. Fresh is best, frozen second, canned is worse. That means getting the proper sleep. 8.3 hours per night of sleep would be the ideal number. Most of us get far less than that. I know I do, and I'm definitely guilty of that part of the equation, of not doing as well as I could be doing. I just seem to, come nighttime, I seem to get functioning better. A lot of things I get done I couldn't get done during the day. And I'm sure a lot of people are that way, but I'm guilty of not structuring my day well enough so that I can get in bed early enough and have a better night's sleep. I sleep well when I sleep, but sometimes I don't get as much as I should get. So that's something that we all need to try to be very aware of. Watching the junk food, watching the sweets. begin to read your labels. Get away from the sodas, get away from the teas. The diet sodas are actually worse than your regular sodas. They usually have things like aspartame in them, and aspartame is a major negative for your body. But start reading your labels. When you pick up something, read the labels, and whatever's first on the labels, what's most, and so forth on down the line. So if you pick up a bag of potato chips, and the first item is a potato, and the second item is some kind of vegetable oil that it was cooked in, and the third item is salt, well, that's going to be a pretty decent product.
Yeah.
Because you already got your baked potato, not baked, but you already got your potato, you got the grease it was cooked in, and you have salt. But now you pick up the next bag of potato chips, and it has 15 ingredients. Well, the more ingredients, you want to be cautious when you pick an item up. The less ingredients, usually the better that item's going to be for you. That's not an absolute, but it's a good generality. The more, when you pick up, say you pick up a bag of chips that say, I don't know, barbecue something something, and that bag is probably going to have a whole bunch of ingredients, where the plain chip might have only had 3 ingredients. So just be careful. The more ingredients, often the worse. And you want to, when you're picking up your label, if the first item is sugar, cornstarch, things like that, those are the kind of things you want to leave on the shelf. You want the sugar to come in 4th, 5th. The further down the road the sugar comes in, the better. Now, a lot of people, they'll tell me, oh, Doc, I stopped drinking all the sodas. I'm only drinking tea now. Well, the way that most people in our area drink tea is loaded with sugar.
Yes.
So you want to avoid that. School's getting ready to start back, so to all you parents, don't go out and buy those Hugs and the Juicy Juices and the Punch. All those things are negative. They're very high in sugar. Your kids may like them because they're high in sugar, but they're not good for the kid's functioning. They're not good for his brain. Or her brain. Our brain lives on sugar. Our brain lives about 80% sugar, but the brain doesn't want to get it as a big jolt. It doesn't want to take a spoonful of sugar off the table and just eat it. That's not the way our brain does it. The brain would much prefer to get the sugars in the form of a starch. Now, starch gets in your body. That's a long-chain sugar. It gets broken down into simple sugars, and then your body utilizes it. But it comes into the system more slowly. So you want to be careful with that. And I did, again, I know we're coming near the end, but as we get ready to start back to school, parents, be careful about the snacks you buy. When you go to the store, read the labels. Don't just grab something because you saw it on television. Don't just grab something because you might have done that in the past. But become a better consumer of that your kids are going to put into their body. They'll perform better if you give them better nutrition. It's going to last longer in their system. Starting a day with a good, healthy breakfast as opposed to a Pop-Tart. It's probably going to do your kids a whole lot better. But I know we're coming to the end, so for those of you who want to see me directly or talk to me, you can always call the office at 252-332-6484. You can go by my website, AskDrFerguson.com. You can go by the youtube.com/user/AskDrFerguson. If you forgot all those things, just go to the browser on the Google window and type in Stephen Ferguson MD, and you'll find probably about 4 pages on the internet of things that I'm involved in.
All right. Thank you, Dr. Ferguson.
On that note, be blessed to you locally and to international. Have a wonderful day. And to all of you on our international circuit, thanks for coming and visiting with us. Tell your friends about it. Tell them to come back each week from 9:30 to 10. We'll be doing the radio station, and we do it live on the internet. And also, you can get the archive copies when you go to my website, not the website, but the YouTube site, youtube.com/user/AskDrFerguson. Go there and join us. And again, tell your friends about us, and want all of you to have a blessed day and have a wonderful rest of the week. All right. Bye-bye.